Alright, we're going to continue our lab video here covering the muscular system. We're on page 21 of the lab packet, looking at the different muscles that attach to the skeleton. So objective number 5 says to identify the following superficial skeletal muscles and recognize a major action of each. So you'll notice on the right hand side of the page there on page 21 of your lab packet, it lists specific actions of each muscle. Be sure that you learn those actions as they are described there. Know the terms adduct, abduct, and flex and extend. Those are important terms that are kind of universal terms when we talk about movement. So very important that you understand what that means. So to flex, maybe in the notes portion on the bottom of page 21, we'll define these terms quickly. So to flex means to decrease the angle at a joint. So if we are flexing our elbow, that means that you are bringing your wrist toward your shoulder, you're bending your arm inward toward the body, you're decreasing that angle between the lower arm and the upper arm. So that's to flex. To extend the arm at the elbow means to straighten your arm. So you're bringing your wrist outward away from the body, increasing that angle at the elbow. So to flex means to bend it toward the body, decreasing the angle, and extend means to bend it away from the body and increasing that angle at a joint. If I'm flexing the head, that means I'm bringing my chin to my chest. If I'm extending the head, that means I'm putting my nose in the air and looking at the ceiling. That's extending the neck. If I want to extend the leg at the knee, that means I'm bringing my leg forward as in kicking a ball, so I'm straightening the leg. And when I'm flexing the leg at the knee, I'm bringing my heel back toward the buttocks, and that is to flex the leg at the knee. If I'm flexing the hip, that means I'm bringing my knee upward, as in when you're riding a bicycle and you bring your hip or you bring your knee upward at the top of the circle of rotation on the bike. That's flexing. And to extend the hip means to bring the leg backward behind the body, straightening the leg and pulling it behind your body. So that would be extending the hip. Then we have the term abduction and adduction. Abduct means to move that body part away from the midline. You've heard the term before, to abduct a child, or abduction means to take a child away from the parents. So to abduct means to move that limb or body part away from the midline. So when we abduct the leg, we're moving the leg to the side, keeping the leg straight, moving it away from the midline. And then to adduct means to bring it back toward the midline, moving it toward the body. To dorsiflex the foot, to dorsiflex means to bring the toe backward. So if you're taking your toes and bringing them toward your nose, that's dorsiflexing. And plantar flexing means to bring the toe downward, as in pointing your toe downward. That's plantar flexing. So be comfortable with the terms flex and extend, make the motions with your body, abduct, adduct, and dorsiflex, plantar flex. And I'll also post a video as a separate link showing you these motions so you can be sure you understand what those terms look like. So starting off with the muscles of the head, looking at this picture here of the head, the occipital-frontalis is a muscle that runs from the front of the head toward the back. There's this is your textbook, I believe, calls this the frontalis muscle, but occipital frontalis is fine for our purposes. So it's the muscle of the forehead here, and it allows us to raise our eyebrows. So that's the occipital frontalis muscle. And then we see some round muscles that go around the eye and also around the mouth. The one that goes around the eye we call the orbicularis oculi. So orbicularis oculi. Orbit means to go around. So think of like how the planets orbit the sun. So this is an orbicularis oculi. And when we work that muscle, that allows us to close our eyes, the orbicularis oris. Then we have the muscles of the cheek, which are the Zygomaticus muscle. I might have no, I don't have a straight on view. But the Zygomaticus muscle is made up of two strands of muscle on the front of the face, just by the upper cheek. And you'll see it kind of, like I say, two different strands. There's a minor and there's a major. This is the larger one, the major, and this is the minor. These are the two Zygomaticus muscles. And if you look at the function of the Zygomaticus, it's to elevate and abduct the upper lip. So it's the smiling muscle, the Zygomaticus. Abducts and elevates the upper lip. So the Zygomaticus. And then we have the Orbicularis Oris, and this goes around the mouth. It's a circular muscle all the way around the mouth, and this allows you to close the lips. That's the Orbicularis Oris, going around the mouth in a circle. And then the Masseter is this thick muscle here, just over the jaw, where the mandible, over the ramus. This is the masseter muscle. It's the chewing muscle. So if you clench your teeth hard and make a chewing motion, you can feel this muscle bulge here. That's the masseter. And then we have and if you look at the function of the masseter, it elevates the mandible or closes the jaw. And then we have the temporalis muscle, and this is along the side of the head, over the temporal part of the temporal bone. And that is responsible for also elevating the mandible and closing the jaw. So if you've ever chewed gum too long, sometimes you get a headache or the side of your head hurts. That's the temporalis muscle that's been working too long and too hard. Some people are tooth grinders at night and they'll wake up with a headache in the morning in this area as well, and a tired jaw, and that's a sign of grinding the teeth at night. And some people do that in response to stress. Then we have the Sternocleidomastoid Muscle, and this muscle is named for where it attaches. It starts at the mastoid bone as part of the temporal bone behind the ear here, so it attaches there, and then it comes down and attaches on the front of the sternum and the clavicle. So sternocleido refers to sternum, clavicle, sternocleido, and then mastoid attaching to the mastoid bone. So if you turn your head, if you put your hand behind your ear, turn your head hard, either left or right, follow that muscle down, and you'll feel how it attaches right to your sternum. It's kind of a thin muscle coming down and attaching to the sternum. And this is an important muscle that we look for people with respiratory problems. Sometimes this muscle becomes prominent as people are using that to help them breathe. As they're elevating their chest in breathing, this muscle tends to be strained in the process, and it's an accessory muscle for breathing that should not be used in healthy, or should not be seen when healthy patients are breathing. So if you look at the function of it, if both of them are contracting and shortening, it's pulling the head downward. So it's flexing the head and neck. And if only one of them is contracting, it's pulling the head either to the left or right. So be sure when you read the note card, if it's flexing the head downward, as in both are contracting, or if one of them contracting, then it's rotating the head. So be sure that you read the card to know if we're talking about both of them contracting or one of them contracting. Then we move to some of the muscles over the back, and we have at the top of the shoulder here the deltoid muscle. It's wider at the base and narrow at the bottom here where it attaches to the humerus. That's where it gets its name, because the Greek letter delta is a triangle. So this looks like an upside down triangle over the upper arm. So that's the deltoid muscle. And when you bring your arms out to the side, that is an abduction. And the function of the deltoid is to abduct the arm. So it helps bring the arm outward in this direction, as if you were straightening your arm to make your body look like a T. Then we have the trapezius muscle, and the trapezius muscle is a diamond-shaped muscle. It attaches to the back of the skull, comes down over the shoulder, and then comes down at an angle and attaches to the spine. So we find it on both sides. It's been peeled away here on the right side of our diagram, but that's the trapezius muscle. So it goes over the shoulder and down to the middle of the back. So the function of the trapezius is to extend the head and neck. So when you raise your chin looking up at the ceiling, that's the trapezius muscle that's shortening and pulling your skull backward to allow you to look upward. And it also moves the scapula. So when you're shrugging your shoulders, that's the trapezius muscle that's acting. And you'll notice after each one of these muscles here, there's an A or a P, which means you should look at this view for either anterior or posterior to see these muscles. Some of the muscles may be visible on the anterior side, but they're best seen on the side that's indicated here in your lab packet. So be sure to pay attention to the A and the P. And it's a great way to group these muscles so you know which ones to look for on the front side, which ones to look for on the back side. The more you can group muscles together, the easier it's going to be to remember them. Then we have the Latissimus Dorsi, and the Latissimus Dorsi, think of lat as in lateral, so it's on the lateral sides of the back, and dorsi meaning dorsal, like the dorsal fin on a shark sticks out of the water. That's the back side of the body. So we have here this wide sheet-like Latissimus Dorsi muscle. And we call this muscle being responsible for the power stroke. So it takes that arm and moves it behind and over the body, as if someone was, for example, doing the freestyle swim stroke. That would be the Latissimus Dorsi. So if you look at a person like Michael Phelps, who was an Olympic swimmer, you see that he was very wide in his lower back here, just below his arms. That's because of the well-developed and very strong Latissimus Dorsi muscle. Then if we look around to the front side of the body, over the chest is the Pectoralis Major, and that adducts and adducts and flexes the arm. So when we're bringing the arm toward the body, that's the Pectoralis Major that is doing that. And when we're flexing the arm, that means we're bringing the arm upward. That is moving or using the Pectoralis Major muscle. So adducts and flexes the arm. This is over the chest. Then looking at the abdominal muscles, some of these are deeper muscles, so they're superficial muscles, and then there's ones that are deeper, so you have to peel them away in layers to really see all the abdominal muscles here that we need to be responsible for. We'll start with the Rectus Abdominis muscles. This is what we call the proverbial six-pack, the Rectus Abdominal muscles, and notice the fibers run straight up and down. They're kind of considered like erect. That's where rectus comes from, and they're over the abdomen, so the rectus abdominal muscles. Notice that you have to peel away a sheet of tissue. This would be another example of an aponeurosis here, which is just an extension of the epimysium of these muscles. So it's not a tendon, but it's a sheet of epimysium, so we call this an aponeurosis. So if we peel that away, we can see the rectus abdominis underneath. And if we flex those muscles, shorten those muscles as if you're doing a sit-up, that's what we call flexing the vertebral column or compressing the abdomen. So people who have very weak abdominal muscles, rectus abdominis, have trouble compressing the abdomen, as in when you need to cough hard. So people with respiratory conditions that have weak abdominal muscles sometimes have trouble clearing their airways, and especially we see that in the elderly, and that's what puts them at risk for pneumonia and other respiratory infections, because they just have trouble clearing their airways after a bad cold. Looking at the next set of muscles, the external obliques. These are muscles that come in at an angle over the abdomen. So these are the external obliques. They are superficial muscles, so we can see them here. That's where they get the name external obliques. Obliques, again, meaning those fibers are running at an angle. And they have the same function as the rectus abdominis, to flex the vertebral column, as in doing a sit-up, and compressing the abdomen. The internal obliques are beneath the external obliques, and notice that the fibers run at a right angle to the external obliques. And so we just go one layer deeper to find these. These are the internal obliques. So look for the fibers to change their direction, but again, they are running at an angle. They're running from the midline to the hip. So this is the internal oblique, where here we see these are running from the lateral edge of the hip toward the pubis bone. So that's the external. These are the internal. Same function, flexing the vertebral column, compressing the abdomen. And then for the transversus abdominis, these are even deeper. They're below the internal obliques. Notice they are transverse. They run horizontally, the fibers, inside the abdomen, and their job too is to compress the abdomen, as in coughing, laughing, exhaling hard. That's the transversus abdominis. So we're working from the outside in here to identify these muscles. Then we look at the muscles over the ribs. We have the different external intercostals, and these are important for elevating the ribs, for quiet breathing. We don't really have to think about that when we're breathing. They just kind of happens very naturally. And there's a picture in your textbook. I have an older version of the textbook in front of me here, but it's table 10.5 that shows the external intercostals. They lie, like I said, between the ribs. And I'm trying to find them here. Yeah, I don't think I have a great picture. I'll have to show you this on one of the models. But the external intercostals, like I said, are shown on table 10.5 of your textbook, lying between the ribs. Then we have the muscle of the arm on the anterior side. This is the Biceps Brachii. So the reason why it gets the term biceps, means it has two heads where it connects or attaches to bone. And its job is to flex the arm at the elbow. So when you're lifting a dumbbell at the gym and you're bending the elbow, bringing the wrist toward the body, that is flexing the arm at the elbow, and that's using the biceps muscle. Make sure you don't forget that second name, brachii, because there is another biceps muscle in the lower part of the body. So the brachii, or brachial region, refers to this portion of the body, the upper arm. So be sure that you say biceps brachii. And then if we look at the back side of the arm, we see the arm on the opposite side that works against the biceps, works opposite the biceps, so this helps straighten the arm or extend the arm, and this is the triceps brachii. So that extends the arm at the elbow. So that's the triceps brachii. So if we look at these muscles here, we have the biceps. This is on the, I'm trying to make sure I look at this the right way. Okay, so this is the, for looking at this muscle here, this would be the deltoid muscle here coming down, and then we have, this would be an example of the, this would be the thumb here, the pinky here. So this is the right arm that we're looking at here. So this is the triceps, this would be the biceps, and in between here would be the brachialis muscle. So the brachialis muscle is between the triceps and the biceps if you're looking at the arm in this view. So we have, again, the triceps, biceps, and brachialis muscle. And I want to show you, we have another view here of the different muscles. I think this is the arm here. Yeah. So here's a nice view. You have a copy of this in your folders that I provided for models in class, but here's the deltoid again, and then here is the triceps brachii. The brachialis is number 4 and the biceps is number 2. So looking at the outside view of the arm, we can see how these are related to one another. So the brachialis is just between the triceps brachii and the biceps brachii. But as far as actions, the biceps brachii and the brachialis together flex the arm at the elbow, and we said the triceps extends the arm at the elbow. So be sure that you are able to distinguish between those. All right, so going back to our view here. So that concludes the, well, I guess there's one more thing we need to talk about, the lower arm. So we've got the extensors and flexors of the wrist and hand. So you don't have to know the individual muscles here of the lower arm. All you have to know is are they extenders or are they flexors? So extenders of the wrist and hand would be pushing your fingers outward, exposing your palms. That's an extension of the wrist and hand. So if we look at, this is the top of the hand here, these are the extensors of the wrist and hand. So we're bringing our fingers back toward our shoulder. That's an extension of the wrist and hand, and these are the muscles responsible for that. If we look on the inside of the lower arm, this is the palm side of the lower arm. If you bring your wrist inward toward your body, that is a flexing of the wrist and hand. So this is these muscles here are the flexors of the wrist and hand. You don't need to know their individual names, so just because this picture here names them individually does not mean that you're responsible for those. Only look at your lab objectives. So all you have to know is all the muscles on this part of the lower arm are the flexors of the wrist and hand. You do not need to know them specifically, in terms of the individual muscles that make up the flexors of the wrist and hand. So this concludes the muscles on the upper side of the body. Our next video will go through the muscles of the lower part of the body.